Well, welcome back. This is still the AM show, and there's a lot going on today. So the Health Service Workers Union are going on strike. They say that anything that will require you to go to the hospital, really, when you go there, they won't be there. And if you insist on going there, you'll find that there's no one there and you have to go to a private facility. There are over 28,000 members of the Health Services Workers Union of the Trades Union Congress, and they have been directed by their leadership to abandon their post. Now, this is because of government's failure to review the conditions of service of its members. So that's happening. Also, they're saying that government has made a decision to deliberately cause disharmony within the health sector. Now, of course, we have so many questions. First is, how will it affect healthcare delivery? When you go to the hospital, how are you going to be treated? How are emergencies going to be dealt with? There's so much happening in the hospitals every day. And so to just have it completely shut down because workers are not available is a massive, massive problem. So we're going to get into that conversation properly a little later on. But we're also talking about the Immigration Service, the Ghana National Fire Service. The president has launched this alternative livelihood program. Last week we were talking about entrepreneurship and, all of that. There's a lot going on in terms of employment, finding a job, finding some job security and all of that. I want to know this morning, what do you think? What's on your mind? What's bugging you this morning? Are you worried about healthcare? Are you worried you're going to go to the hospital and there'll be nobody there? I was at 37 Military Hospital on Sunday, and it was really, really busy. But there was staff, right? There were doctors, there were nurses, there was a lab technicians, the pharmacies. This morning, if you go to any public hospital, you may not find some of these workers there. So how does that make you feel? What do you think about it? And also, do you want to share your experience with me if you've tried to get into the fire service or you've tried to get into the immigration service or military? What's that been like for you if you tried last year or last 2 years, or even if you're trying this year? Maybe you went and today you've decided not to go, or you're going to go today, or whatever it is. I'd love to hear from you. Give us a call. We'll put the numbers up on the screen shortly. So tell me what's on your mind. What's going on with you? There's also the EC stuff happening. They've said that ex-President Mahama should come and explain and give, evidence of the things that he's accused the EC of, including the overprinting of ballot papers and all of that. So I'd love to hear what you think. Can we get the number up on the screen? And then, you can call us and tell us what's on your mind. Also remember that we're live and interactive on Facebook, on Twitter, and on Instagram. Okay, so the numbers are there, 0302-211-691 or 0302-211-692. Question is simple. What's worrying you this morning? Are you over the Hearts of Oak defeat? Or like me, are you still desperately grieving for not the team, but for the fans who are your friends? So what's else on your mind? What's on your mind this morning? I really want to know. But okay, let's why don't we listen to the Health Secretary of the TUC? He's been speaking on the strike.
Because members are outraged and fed up. The dragging of feet and the lackadaisical attitude and nature with which the government handles the issue of Health Services Workers Union members can't be tolerated any longer. In the light of this, the union is telling the citizens of Ghana that it is unfortunate, but please don't forsake. We are telling members that should unfortunate happens, please seek healthcare treatment in private sector because the public sector will not be available. To the general public, We want you to know that the union wishes to state categorically that it is not its wish to cause industrial disharmony and disrupt the smooth delivery of health services, but the continuous disregard by the government team to respond to our simple request has pushed us to the wall and this far. Now to our cherished members who have been patient enough to work up to now, we salute you. Today, 25th October 2021, must be the last day that you will go to work as you have demanded. From tomorrow, 26th October 2021, please stay at home till you hear from your leaders. Your resumption to duty will depend on the government's team calling on the union team to negotiate in good faith and to conclude all outstanding issues. We entreat all members to stay resolute, fearless, focused, and united to fight until the union's requests are fully responded to. Long live workers' solidarity.
Long live.
Long live HSWU.
Long live.
Long live Ghana.
Long live.
Okay, so let's get into the conversation. And joining us via Zoom is Albert Sorry. He is our correspondent in the Upper East, and he's going to be telling us what's going on there. Good morning, Albert.
Good morning.
Okay, so what's the situation on the ground? What's happening this morning?
Yes, so the Health Services Union, Health Services Workers Union branch in the Upper East region yesterday indicated that they will be complying with the directive from the national body to embark on the strike today. And so they have given notice that from today, just like their national executives have indicated, their members here in our region will be going on the strike. Their executive said that up to 21 different groups of workers working in health facilities across the region will not be coming to work today. And what they have decided to do is that the regional executive will act as a task force to go around the hospitals and various health facilities to ensure that their members comply with the strike. This morning, I haven't been able to check with most of the health facilities yet, but it's early days, so it's difficult to tell whether the impact of their decision to strike can be seen at the moment. So we are looking at later in the day, so we can monitor and see what really the impact of the strike will be on people seeking healthcare in healthcare facilities across the Upper East region.
Right. Do you have any information on how emergency services are going to be dealt with?
Well, what they have said is that, there are members, people who work in the hospitals who don't belong to their union. One of the examples they gave was nurses and doctors. And so for workers like disease control officers, laboratory staff, and some other essential, health workers who are members of their association will be going on the strike. So laboratory services, for instance, is likely to be one of the emergency services that will be affected. But just like I said, we have to see what happens in the course of the day.
Okay, so you don't have any information about ambulances being redirected or information going out to the public, that if there's an emergency, don't go here, or do this or do that. Have you seen any sort of communication like that coming out?
Yes. So yesterday, one of the things they said in the press conference that they held in Bolgatanga was that they wanted the general public to know that this was what was going to happen. And so if you are going to a public healthcare facility and you know that the sort of service you are going to seek, has to be given to you by people who are members of their union, you probably have to start looking at the private healthcare facilities as an alternative because you will not be getting their services. So they did give that indication.
Okay, so you've mentioned doctors, nurses, lab technicians. Who are some of the categories of people that are under this this health services workers union and who are on strike?
Yeah, one of the other group of workers they mentioned were disease control officers. And then he didn't go further to mention so many others. But what he said was that there are as many as 21 groups of workers who, work in the various healthcare facilities. So, that's the breakdown of, the group of workers who will be expected to embark on the strike.
Okay. Well, thank you very much for that, Albert. Sorry, we'll be coming to you a little later on to find out exactly what's happening at the hospitals this morning. Thank you so much. Okay, let's speak to Anas Sabit. He's our correspondent in the Bono East region. Good morning.
Good morning, Anim.
Okay, Anas, so what's the situation on the ground this morning?
Yes, like Albert just said, the situation is still here. I have been to one of the hospitals here. Unfortunately, it seems too early for us to confirm whether this health service workers union are actually turning in to work today or they wouldn't, except that I have been able to speak with the Minister of Health Director, for instance, here in Kichiman, Dr. Fosin, and he told me they've been given a notice by this group that they are embarking on their strike action today. And so they say we have to wait until after 8 a.m., getting tonight, 10 a.m., then we will see whether actually they are withdrawing their services or not. But what he added is that once they've been served notice, they are also, the notice is in a way affecting their line of work today. They were supposed to go for some vaccines for the ongoing COVID-19 vaccinations. And because of the notice they received yesterday, they have decided not to go for the vaccines today because once they pick the vaccines without the input or the service of this, health service workers, they won't be able to embark on that particular vaccination exercise. So today, from what I've gathered, it is not possible that the vaccination exercise that is carried out or that is being carried out here in the Kichiman municipality will go on because of the notice they received from the Health Service Workers Union here in the Kichiman municipality.
So basically this morning, everything is kind of normal?
Yes, they to show up and start work usually after 8 a.m. As we speak, we know they've served the notice. They are likely not going to come. We can't tell as it stands whether they are coming or not. But the Minister of Health authorities are also making sure that we do not, plan with them ahead of the day's work. So they are not going for their normal, vaccines as they used to. They will have to wait until maybe after 10 a.m. to somewhere midday to ascertain whether actually they are withdrawing their services as they served the notice to them yesterday.
Okay, do you know if any measures have been put in place by the hospitals to make up for the absence of some of these health services workers?
Well, I tried to speak with the administrator of the Abreast Women's and Children's Hospital, which is one of the major health facilities here in the region that belongs to government. All my attempts to reach him is proving futile. But from the Minister of Health Director, without the services of this health service workers union, it's going to be very difficult for the health facilities to discharge their services as they used to, because he says with the exception of the doctors, the nurses, and then the pharmacists, all other, workers that are in the health sector are part of this particular strike. So once they withdraw their services, that means the doctors, the pharmacists, and then the nurses, it's going to be very difficult for them to discharge their duties as normal. So actually, if they withdraw their services, it's going to affect healthcare delivery largely in the health facilities in this area.
Okay, are there lots of private hospitals in your region?
There are, but most of these private facilities are in the regional capital, which is Tichiman. For instance, the largest health facility in the whole Bono East region, the Holy Family Hospital, is a CHAC facility, belongs to the Christian Health
Association of Ghana
in the country. Association of Ghana, that is CHAC. So it's more or less like the referral point for almost all the health institutions in the region. We also have the Ahmadiyya Muslim Hospital, which is also another major hospital. We have a number of private health facilities in Techiman. Beyond Techiman, you go to Nkranza, you go to Kintampo, you go to Atebubu. Almost all these major areas in the Bono East region rely solely on the government facilities. We have the Kintampo Government Hospital, we have the same in other parts of the region. So the people in Techiman may not feel it immediately because of the number of private facilities in the regional capital. But the hinterlands, the rural communities, and then the other parts of the region would be heavily affected because they are solely relying on, government facilities in the area, health centers, chiefs compounds, and then district or government hospitals.
Okay, so we'll come to you a little later and ask to find out what's happening. You've indicated that the day shift would usually start around 8 o'clock. So it's at that point that we'll be able to tell, whether the health workers are actually going to show up for work or not. But for now, looks as if everything is normal, at least for the next 14 minutes. So, that's it. Okay, well, thank you so much for joining us. We'll talk to you a little bit later. Israel, hello.
Yes.
Okay, so we're going to have a conversation now. Or Israel, I think you're going to have a conversation now.
So
with Franklin.
Yeah, Franklin Owusu-Ansah, he's the General Secretary of the Health Services Service Workers Union, and he's joining us right now. Good morning to you, Mr. Owusu-Ansah. Hello, good morning, Mr. Owusu-Ansah.
Hello?
Yes, okay, good morning. It's good that you can hear us now. So,
hello?
Yes, so we can hear you. It's good. So we've tried to assess the impact of the strike, and it appears...
I can't hear you, please.
You can't hear me? Hello, Franklin? All right, so we'll try and rectify whatever challenge it is so we can get to speak with Franklin Owusu-Ansah. So, yes, as our correspondents have been saying, it's pretty early in the day to get to see how much of the strike is impacting people. And it's also important to get to understand the workers or the category of health workers that are involved here. Certainly not the nurses and not the doctors, but they need all these other people to get to work with, the laboratory staff, as we've heard, and several other categories of workers at the hospital or in these health facilities. So it's important that they are actually available. Let's try and see if the connection to Franklin is better now. Good morning, Franklin Owusu-Ansah. Can you hear me?
Yes, I can hear you, my brother.
Okay, great. So have you been able to assess the impact of the strike yourself?
Yeah, good morning, and good morning to cherished listeners. I want members to know that we have regional officers who are in the region to monitor what members have called for. And so to also add that the private facilities that you mentioned, including SAG and Ahmadiyya, they are all part of this exercise because it is one collective bargaining certificate, one collective agreement that covers all this category of workers. And so if government workers are not working, it is not because they are government, but it is because they are part of this single collective agreement.
Franklin, I want to understand, so which category of workers in these hospitals are expected to lay down their tools?
Well, I have about 65 category of workers working in the public health sector who are members of the Health Services Workers Union.
Such as?
Maybe I'll mention some few.
Yes.
Nutrition officers, disease control officers, health promotion and health education, radiographers, that is in the X-ray, sonographers, all the people working in the lab, physiotherapy or physiotherapists, pharmacy technicians and pharmacy technologists, drivers, emergency medical technicians, that is those in the National Ambulance Service, health educators, field technicians. We are talking of the administrative staff, that is administrative managers. We are talking of HR managers. We are also talking of those in the accounts department. We are talking of biomedical engineers. And we are also talking of all those working in the laundry.
Okay.
And the kitchen.
Franklin.
And as well.
Franklin, so it sounds like everybody else, apart from the nurses and doctors.
And pharmacists.
Pharmacists.
So apart from the nurses, doctors, and pharmacists?
Yes.
Right, so what exactly is the issue when you say your conditions of service, government is refusing to improve the conditions of service?
In the year 2015, the Health Services Workers Union signed a collective agreement with government implementing some conditions of service, some monetary, others non-monetary. The agreement was supposed to be in place from the year 2016 and 2017. But after 2017, we have tried as much as we can to make sure we review this document. In the year 2019, government started negotiating with us on this agreement, and we have not seen the review up to today. But even the first one that we negotiated, the implementation became a problem. But among the 4 collective agreements in the system, in the health sector, 3 have been reviewed. Even 1 has been reviewed twice. The other 2 have been reviewed since last year, and they are all in operation. Why is it that the Health Services Workers Union 1 cannot be reviewed and cannot be in operation? Is it that we are being discriminated against or what? Is it that our services are not needed or what? All that we are saying is government should sit with us in good faith, and we want to believe that we will reach a consensus. And as I'm speaking, we have been called by a letter to continue the negotiation today. And I want to believe we will be able to end the negotiation because the items that are left with, we have done all the costing, we have done all the nitty-gritties that needs to be done. And so once they come with the mandate and in good faith, we will be able to conclude on the negotiation.
All right. Are you saying that between yesterday and today that you announced a strike, you've gotten an invitation to come negotiate?
Yes, we got an invitation yesterday.
So if you have the invitation, why are you then going ahead with the strike?
We announced the strike before we were called. And trust me, it is not just Franklin who sits somewhere and announces a strike. The National Executive Council has to meet and announce a strike. And the same National Executive Council has to meet to undo it. And it is not just National Executive Council all living in Accra.
Okay, that's good.
From all the regions.
Franklin, so now you have the opportunity to reach out to your colleagues and the other executives and members and have that meeting and decide whether, because you can't really be negotiating whilst you're on strike.
Well, let us finish today's meeting. The outcome will determine what we will do next.
How soon are you going to call your executives or the national executive to have this meeting so that you can decide whether you want to...
How soon will depend on the outcome of the meeting today.
What do you expect to hear at the meeting that will convince you to have this meeting?
We are going with good faith negotiation. Negotiation is all about win-win. Negotiation is about give and take. And we are ready to jojo at the table and reach a consensus.
So
we are not going to hold anybody to ransom.
All right. So essentially, if you go into this meeting and you hear something favorable, you're likely to call off the strike?
Why not?
All right. So, well...
And I can. Yes, I'll come on me. And if we are okay, why then do we hold on? In our statement yesterday, we said that we are not happy calling for this industrial action, but we have been pushed to the wall. And for that matter, anything that comes to the table that satisfies both parties, this industrial action will be called off.
All right. Thank you very much, Franklin. And we're actually hoping that you hear something favorable so that you can call off the strike, because it's likely to impact people, as you're indicating. Thank you very much. Franklin Usu Ansah is the General Secretary of the Health Service Workers Union, and he is indicating that they've been invited by government to a meeting, and they're hoping that after this meeting, if they hear something favorable, they're likely to call off the strike. We're anticipating that that's what's going to happen.
Yeah, okay, well, let's anticipate away. I'm glad that they're not calling off the strike because of the negotiation, because we saw what happened with the University Teachers Association. So, I mean, sometimes I feel like that element of good faith, has been eroded. And so when you're asking for something, hey, you hold government to ransom, really, until you get what you want.
Really, I would have thought that if you're going into a negotiation, you don't go into a negotiation holding a gun to the head of...
Well, sometimes you have to, once bitten, twice shy. So anyways, they're talking today, so hopefully something good will come out, and that'll be it. But I opened the phone lines a little earlier on, and thank you to all of you who called, even though we didn't get into it, because we really needed to have this conversation. But let's get into it now. So call us, give us a call. Tell us what you think about this strike. Also tell us what's on your mind, 0302-211-691. or 0302-211-692. Give us a call. Tell us what you think.
Right, yes. So let us hear from you. And the other issues we're going to be talking about a little later has to do with the hundreds and thousands of people who are out there trying to get enlisted into the Ghana Immigration Service, the Ghana National Fire Service, and other security agencies. We'll be out there to monitor the exercise to see how it's going again today. It's supposed to be for 4 days, at least as far as immigration is concerned. It started yesterday, Monday, and we're expecting the numbers to be out again today. But it's interesting that, yes, government has indicated, or the finance minister has indicated, that the payroll, public payroll, government payroll is full. We can accommodate, I'm sure they can accommodate a few more people before it becomes completely exhaustive. And yes, we need more immigration staff. We need more fire service or firefighters, and we need more prison service. So yes, let's do
but
that.
I said, we only need more of these people if we're going to expand the infrastructure.
I'm sure that's also I'm sure that's also in the works.
Okay, so we have Theo calling from Mampong. Hello, Theo. Good morning.
Good morning, madam.
Hi, what's on your mind this morning?
Yeah, I just want to say something about the strike by HSW. Mm-hmm. Yeah, I think it's not about holding government to ransom, but it's as if the only language politicians understand workers who strike. The workers have a genuine cause or a genuine reason why they are demanding for one or two things. But you realize that if it is the turn of the politician, once something is tabled before them quickly, it is accepted. But it comes to the ordinary Ghanaian worker, they will be going back and forth here and there until something happens. Unlike the case of the nurses and the doctors, once they go on strike, that is when they realize that they are important to the society or to the citizenry, and then quickly they do what is needful. So I don't think going forward, workers need to go on strike for some of this to be addressed. And I hope that, whatever they have to say today should be concluded so that at least everything can return to normal. Thank you.
Okay, well, thank you for that, Theo. Let's speak to Emmanuel from Kumasi. Emmanuel, good morning.
Good morning.
Okay, so what's on your mind?
Okay, that's what I have to say. In fact, we are in a country where I think everything is open. People are being treated fairly, that is with regards to those in the Article 71. But with other groups, they are being treated as if their services are not essential. This is a group that has been fighting for this thing for 4 years now, from 2017. Now they're linked for this time. And the government is similarly proving like that is not important. I think it should be given a critical look at so that they can save whoever that comes to the hospital or whoever moves to affect whatever that they need at the hospital. Thank you.
Okay, thank you so much for that, Emmanuel. Let's go to Osman from Second Year. Osman, good morning.
Good morning.
Okay, what's on your mind?
I think that's the only language the government or the believe in. Because Ghanaians are suffering, but all governments, when they are in power, they don't care who we are unless we go on strike. But look at the MPs, how they gain their ministers. How they're the only Ghanaians. And this NLC, we ban. But when the workers are suffering, they go to NLC, everything. They don't for them. They don't for the government. Who defend the government? That's very bad of them. We are all Ghanaians. Yes. We should think about our and how workers to improve their livelihood. Thank you very much.
Okay, thank you so much, Osman from Second Year. Let's go to Tamale now and speak to Mohammed. Mohammed, good morning. Okay, we just lost Mohammed. So you can still call us 0302-211-691, 0302-211-692. Also, let us know if you're at any of the public hospitals this morning. What's going on there? We'd love to hear from you. We'd love to hear your situational report. Are you getting access to healthcare? Have you been asked to go and do some labs and you can't find any lab technicians? What's your morning been like at the hospital? We would love to hear that. Okay, we have Hassan on the phone. Hello, good morning, Hassan. Hello? Hello, Hassan?
Yes, please.
Okay, hi, good morning. What's on your mind this morning?
Yes, I think this whole payment or emolument system in this country has to change. Because I don't see how these politicians or political parties will come to the government for years. They don't pay light, they don't pay electricity bill, they don't pay water bill, they have fuel allowance, whatever allowance. At the end of the day, they take as gratia. Yet public servants will work for 30 years or over. And pension, the pension that last time they take for pension is not even up to maybe 100,000. Yet these politicians will come and pay hundreds of thousands of Ghana cedis as gratia. So how do you expect public sectors to work? They pay electricity, they pay their own fuel, they pay housing, whatever. So I think this emolument system in this country has to change. Thank you.
Daniel. Hello, Daniel. Good morning. Hello, Daniel. Hello, Daniel. Okay, looks like we've lost Daniel, but we're taking your phone calls this morning because we want to know what you think and how you feel about what's going on in the country at the moment. The Health Services Workers Union are on strike, and thousands of people are queuing to be able to get application forms for the Ghana Immigration Service, the Ghana National Fire Service, and so on. So what's on your mind this morning? Let's go to Osman from the Western region. Hello, Osman.
Hello, this is Original Shatter from Bogatanga.
I see, Original Shatter. Good morning. How are you?
Fine morning. How are you too?
I'm very well, thank you. So what's on your mind?
Yeah, please, we beg the government. Bolga Central Hospital, Bogatanga Regional Hospital. Please, it has been completed for almost 2 to 3 years now. not opened, and we are suffering. The population here is very huge, and everything has been said. Machines are inside, painted, everything is completed. Why can't they open it for us? Ghana, what is happening to us, our leaders? What is happening? So many schools have been completed. Why are they not opening? Come to Gambaga here. Come to Gambligo here. Come to Tongo Road. Two secondary schools is fowls and lizards and goats that are learning, going there to learn. Why? They should come and open the hospital for us. We are suffering. But Gatanga Regional Hospital have been there for 3 good years past. Original Sata, I'm reporting for the whole Ghana to listen that we are suffering. They should come and open the regional hospital for us with immediate effect. Thank you very much.
Thank you very much for that, Original Shatta from Osman. And you know, okay, so we have one more
Osman
caller.
is back now.
Okay.
Hello, Osman.
Hello?
Yes, okay, so we lost you earlier. So, yeah, where are you calling from?
I'm calling from Western Regional Center.
All right, and what's happening there?
Well, I'm not privy to what is happening in the hospital, but I want to air my view on the issue that is on discussion.
All right.
Yeah. In fact, we appreciate the work that the media does as far as national issues are concerned. Sometimes these are the only ways we can express our frustration. And sometimes the question that comes to mind is that why is it that governments have to wait so long for workers to go on industrial, actions like this before the concern of workers will be addressed? Sometimes, you know, what makes the cleaner in the hospital or the cleaner in any institution work less important than probably even the doctors or the president. This whole thing is a system, you know. If the cleaner doesn't go to work, who is there to make sure the hospital is ready for somebody to come to work? More times, citizens have to complain all time before their concerns will be addressed. And in Ghana, we have gone past this issue. At least our leaders should always be proactive. It isn't all the time that we have to go industrial actions before our concerns will be heard. So I am just using this channel to appeal to our leaders. They should be proactive. They should always try to address issues before they come to the media, before they address them. These things have been discussed way back, but look at it now.
All right.
The citizens have to go to hospital before they will be told that they are on strike. So they have to work. In fact, the media will have to comment beyond that. Thank you so much. That's mine.
Thank you too. Thank you too for calling, and thank you for keeping faith with us, and thank you for the compliments. We're here to work for you. We're here for you, and so we continue to bring us some of the issues and highlight them, and hope that government gets it addressed. Because if we don't talk about them at all, then certainly you know that nothing is going to happen. So yes, we appreciate all of you who have also called. These are issues that matter to you, and we're hoping that the authorities are listening. In fact, I believe they do listen, and so they will do something about them. But I am hopeful that this meeting that they're going to have with the government, they said they've been invited to a meeting. Hopefully, this meeting is going to resolve whatever concerns they have. It may not resolve all their concerns, but maybe after that meeting, they will decide that we've heard something favorable enough, and so we're going to call off the strike, because these strikes impact people, real people. People, if the ambulance is not going to work because of the strike, it means that you call an ambulance in the case of an emergency, maybe an accident, and people can't get to be sent to the hospital. It's worrying. People could lose their lives as a result. So let's get to resolve this as quickly as possible.
Indeed, indeed. I agree with you.
All right, so we have other issues we're discussing this morning. The next issue we're going to be talking about has to do with the people who are out there trying to get enlisted into the Ghana Immigration Service, the Fire Service, and other quasi-security agencies. We'll come back to that after this break. Stay tuned in.